The Philippines is a Southeast Asian country which consists of more than 7,000 islands. Towards the end of 1970s, the Camillian fathers who were already in the country met a young student named Veronica during the vocation promotions in the schools. She recognized her vocation within the charism of the great Camillian family, and she wrote to the Superior General about her desire to join the sister ministers of the infirm of St. Camillus. Consequently, accepting the invitation of the Camillian fathers and the hopes of this girl and other young women, it was decided during the General Chapter of 1978 to open a mission in this nation, the only one with majority Catholic population in all of Asia. On January 1st, 1979, Sister Sara and Sister Lauretta arrived from Italy and with much joy, enthusiasm, and humility began the Philippine mission. The challenges to face were many, but thanks to the faith and love they had in their hearts, they managed to be a living testimony of the tenderness and mercy of God in the footsteps of the Mother Foundress, Blessed Maria Domenica Brun Barbantini, by taking care of malnourished children and of their mothers, and dedicating themselves to the service of the sick and the elderly, especially the poorest. At present, the Camillian Sisters in the Philippines have communities from north to south, and they have many friends who help and follow them in their ministry toward those who suffer in hospitals, homes for the elderly, health centers, and home care. The sisters are also very active in assisting during emergency situations and disasters that often hit the country, such as typhoons, earthquakes, and volcanic eruptions. On December 8, 1985, the new Central House Community and the Formation House of the Philippine Delegation was inaugurated in Antipolo. At present, it remains with the novitiate. The current superior of the delegation is Sister Adelina Labutan. Faithful to the charism, the main apostolate of the community are the visits to the sick in private homes and in the hospitals. The sisters here devote time, energy, and resources to serve the elderly, especially those who are alone and less assisted, as well as the chronically and terminally ill in the neighboring areas and more distant villages. Furthermore, through the Camillian Nutrition Program, the sisters and novices help the malnourished children of the villages in the mountains by ensuring them healthy and complete meals and bringing them joy and love. The lay family of Maria Domenica is very active and present. It supports the sisters in their apostolates. In 1989, the Camillian Sisters Maria Domenica Development Center, a building within the Central House complex, was inaugurated. It is a preschool, kindergarten, and elementary school with special educational program. It offers education to regular children and young adults with special educational needs. At present, there are 115 students at the Maria Domenica Development Center. In 2018, the Barbantini Cafe, a venue for meeting and fraternal sharing, was opened to offer a service to the neighborhood and to support the independent living program of the students with special needs. Thanks to the generous support of some benefactors, in 1989 in Mambugan, in a small hut, the Camillian Sisters Clinic began its activity of providing medical services to the local population. 3 years later, a concrete structure was built and the Camillian Sisters Maria Domenica Polyclinic and Rehabilitation Center was inaugurated. At present, it offers medical and dental services, laboratory analysis, radiological procedures, integrative wellness center with natural medicines as support care for patients with cancer and chronic diseases, social services, and the pharmacy. Sister Daisy Carmona is the directress of the Polyclinic, which assists around 50 patients daily. In 1998, Maria Domenica Home for the Elderly was opened. The 4 sisters present here take care of 41 elderly women, some of whom were found alone and abandoned on the streets. Here, the elderly have a home, food, medical, and rehabilitation services. They are assisted by the sisters and volunteers. Ticos is a beautiful town in Davao del Sur. It is easy to feel at home here, and the four sisters of the community immediately felt at home in 2000 when they started their community life, and more so in September 2002 when they opened the Maria Domenica Home for the Elderly to assist the elderly and sick women who are alone. Now the Home for the Elderly has 25 bed capacity. In addition to the Home for the Elderly, the sisters are involved in home and hospital visits to the sick and promoting primary health care among communities. They collaborate with the local church in the pastoral health care. The sisters also have a scholarship program for the most needy young men and women. Those who have already completed their studies and found a job, in turn, help the younger ones to pay for their studies. Generosity is really contagious. Poverty in these areas makes hospital medical care and treatment with conventional medicine increasingly difficult, if not nearly impossible. Considering this reality, the community has taken the holistic approach, preventing diseases and treating health with the use of alternative methods such as herbal medicine. Some sisters also specialized in traditional Chinese treatments such as acupuncture, acupressure, ventosa, and moxibustion. The sisters also dedicate themselves to the production of herbal soap, detergent, candles, and honey, which they sell to support themselves and their apostolate. Since 2004, in the province of Davao Oriental, particularly in Mati City, the sister ministers of the infirm have been collaborating with the Camillian Fathers at the St. Camillus Hospital. Sister Cleofe Macalino is a nurse at the Infection Control Department, while Sister Bernardita is Ancillary Coordinator. With 50 bed capacity, this is the only Catholic private hospital in Davao Oriental. The hospital has also a support program, a community-based healthcare program. It is a real farm which, in addition to supporting the development of local communities through various trainings, promotes a healthy lifestyle through the cultivation of fruit and vegetables without the use of pesticides, production of herbal medicines, and animal agriculture. The center was created in response to patients' requests as a place to find peace of body and mind. It also offers acupuncture, massage, and herbal medicine services. The production and sale of spices, aromatic herbs, and soaps produced by the sisters allows the center to support itself. Ginobatan is a small town at the foot of Mayon volcano in the province of Albay. In 2018, the sister ministers of the infirm opened a community of 3 sisters to assist the sick and elderly at home and in the hospital in collaboration with the parish healthcare workers and the local government. The sisters travel a long way daily to visit the nearby and distant villages of Albay province to bring help where there is great need and where the Lord calls them. They often encounter cases of mental disorders due to sexual abuse. They also assist the sick affected by diseases due to lack of nutrition and exposed to unhealthy environments. To support their needs, the sisters produce dishwashing liquid at home to sell in the parishes and through the network of lay friends around them. The selfless dedication of the sisters helps to empower people by helping them draw from and develop their inner resources in order to face daily life, which in itself is rather difficult, but is full of great opportunities for authentic human and Christian growth. The life to which the Lord calls you is a life of sacrifice, but I assure you, based on my experience, that the exercise of charity gives you joy and consolation.